begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now in today's episode, I'd like to discuss the common cold and acute bronchitis. Of course, this is a topic of discussion as a result of chat sessions with several individuals over the past 2 days. With the coming cold and flu season while in the midst of this COVID-19 pandemic, some are concerned about acute bronchitis and the common cold. Now, before I get into discussion on the subject, I just want to say if you don't have the Acupuncture is My Life app, simply go to the Google Play Store to download the app to gain access to private chat discussions regarding any concerns or questions you may have about acupuncture and how it can be of benefit to you. Now, back to the topic of discussion and the question I was asked by several individuals in which I was engaged in a private chat session with, which was, what is the difference between the common cold and acute bronchitis? Now, as explained to them, a cold is a viral infection of the upper respiratory tract, which typically goes away in a short period of time with acupuncture treatments, rest, and plenty of fluids. Now, symptoms of the common cold usually include runny nose, sneezing, sore throat, low-grade fever, cough without mucus, and fatigue. Now, when it comes to bronchitis, although bacteria can sometimes cause acute bronchitis, for the most part, it is usually as a result of a viral infection in the bronchial tubes, whereby this infection and its symptoms is usually experienced less in the nose, but more in the lungs, which is usually treated with acupuncture, Chinese herbs, or antibiotics. Now, symptoms can include low-grade fever, cough with or without mucus, fatigue, wheezing, trouble breathing, and chest pain. Now, in most instances, individuals label acute bronchitis as a chest cold. Most consider acute bronchitis as being worse than the common cold. Now, if you find yourself experiencing a temperature of 100.4 degrees or higher and coughing up bloody mucus, trouble breathing, and symptoms lasting more than 3 weeks, contact your primary care physician immediately. Now, in traditional Chinese medicine, acute bronchitis is seen as an exterior condition whereby deficient righteous qi allows the exterior pathogenic factor to attack the lungs via the mouth, nose, or skin, impairing the ascending and descending function of lung qi. Now, in Chinese medicine, all 6 factors such as cold, summer heat, dryness, dampness, wind, or fire can induce acute bronchitis. It all depends on the dominant factor of the particular season in which you're in, whereby patterns of wind cold or wind heat or dryness can be distinguished. Now, last cold and flu season, I diagnosed and treated a case of wind cold attacking the lung, where the patient presented with a barking cough and heavy breathing and an itchy throat, nasal congestion, sneezing, aversion to cold, fever without sweating, headache with body aches. The tongue appeared with a thin white coating and a floating and tight pulse. In that case, I knew I had to expel the cold, disperse lung qi, and stop the coughing. So I needle points on the lung and large intestine channels, to open up the lungs and to dispel wind cold, resolve the exterior and regulate the surface. And I also needed points on the bladder and the Sanjiao channels to regulate lung qi, tonify the lungs, and move qi in the lung channel. I also administered moxibustion therapy to points on the governing vessel as well. Now, the patient fared pretty well after just 1 treatment session, although advised to come in for a few more sessions immediately thereafter to make sure that the pathogenic factor had been entirely expelled. Now, if you ever have any questions with regard to the common cold and acute bronchitis, simply contact your local acupuncturist or go to acupunctureismylife.com or download the Acupuncture is My Life app from the Google Play Store to engage in a private chat session with Acupuncture is My Life regarding those issues and more. But in the meantime, don't forget to subscribe to this channel to receive notification of new episodes published to this channel and much more, and to learn about Eastern nutrition. And until next time, acupuncture is my life. What's yours?